So we're going to start off today and we're just going to talk about a typical woman with lipedema. Hundreds and hundreds of women, when they went through puberty, their body changed. And their body changed not because they did something different. They didn't start overeating. They didn't become couch potatoes. But despite no changes, their body changed. And it changed in ways they weren't very happy, particularly in their legs, occasionally in their hips, and occasionally in their arms. But predominantly we hear that their legs just really changed. And we saw that happen in families, despite not doing anything different. These ladies then go on through their 20s, have children. Some of them do, some of them don't, but many times after pregnancy, their body changes again, not because of anything they've done wrong, but because of just those hormonal changes. Many times by the time a person sees me, they've had heaps and heaps of yo-yo dieting. They've tried all kinds of things, even to the point where they've had bariatric surgery. And they come and see me because they didn't reach the goal that their bariatric surgeon told them that they should reach, and they don't understand why. And they didn't reach it because they didn't have obesity by itself. They had lipedema. And lipedema fat doesn't respond like obesity. So let's really talk about lipedema. So this is what lipedema looks like. You can also call it lipedema or lipoedema, whichever you would like. I like lipedema because it sounds a little softer. As you can see, this is not obesity. Very, very different fat distribution, very different cause, and very different to treat. So when you put them side by side, can everybody see the difference? Even though obesity is kind of believed, or there's a bias that it's all from doing the wrong thing, eating the wrong foods, not exercising, being a couch potato, as these pictures show. Obesity is a lot more complex than that. But you can see the difference in how these bodies look, the distribution of the extra body fat. So let's look at what the definition of lipedema is. We're going to start with a very basic definition, and then we're going to expand that so you really have a good idea. When someone says, well, what is lipedema? You can say, right, I can tell you. Okay? So lipedema is a subcutaneous, adipose, and connective tissue disorder. What does that mean? So subcutaneous is the fat that's just right underneath your skin. We're not talking about the deep visceral fat that's in your abdomen. We're talking about the fat that's just under the skin. And that's the fat that is affected with lipedema. Adipose tissue just means fat tissue. It just makes it sound a little more scientific. But there's more than that. It's a connective tissue disorder. And if you get right down to the definition of what is connective tissue, fat tissue is connective tissue. It's loose connective tissue. So you have different types of connective tissue, and fat is a connective tissue disorder. So if people say, well, what is lipedema? You could just say, it's a connective tissue disorder. Yeah, it affects my fat, but fat is part of connective tissue. So lipedema is the most common inherited subcutaneous and adipose and connective tissue disorder, primarily affecting women. There are other ones that are out there, but this is the most common one that is present, and it affects about 11% of adult women. Rarely in men do we see it, and those would be men that have more estrogen than testosterone, so their ratio there is abnormal. It is an inherited condition, and we see that pass through families. When it typically presents is before age 30. It will worsen if obesity starts to be present. Okay, so sometimes you can have both present, obesity and lipedema, and we sometimes don't know that the lipedema is present until someone starts on their weight loss journey, and then the lipedema fat becomes very evident because it's not moving or shifting like regular excess body weight from obesity. So we have to get away from the blame game, and I apologize to everyone in here if you have been mistreated by people in the medical profession, because I know you have. And I apologize for that. And it really comes down to lack of training and lack of knowledge. And so that doesn't make fat bias acceptable, but it is present. And so I hopefully will be able to empower you that then you can then help teach medical professionals, whether it's a physician or a nurse or a pharmacist or a therapist, that this is actually an inherited genetic disorder, not because you made a bad choice. And you don't need to push away from the table and exercise harder to treat it.